Assalamu alaikum. Good evening, all of you. It's a pleasure here at University of Sharjah, College of Health Science in the Medical Diagnostic Imaging Department. It's a pleasure to welcome all of you to the 125th World Radiography Day. Radiography professionals worldwide, they are gathering yearly on November 8th to celebrate and spread the awareness of radiographic imaging. As all of you know that radiography plays a vital role in today's healthcare, in diagnosing and in treating patients, while ensuring the radiation level to be kept as low as reasonably achievable. And it's very clear for all of us that throughout this 125 years, there were been drastic changes in the field of radiography. For the old people, if you remember the films and the chemicals, I'm one of those people and I'm proud of that. I work using the films and chemical and even the manual processing with hangers and films. Alhamdulillah, I'm here today and now the progress is towards the computed radiography, the CR and the DR. On the other hand, there are lots of development in CT and MRI and other imaging modalities. And today we are in the artificial intelligence era, and I don't know where it will be the end. Throughout this 125 years, there are lots of progression, and it's really going very fast. It gives me a great pleasure today to welcome our colleagues from multiple countries. It's really pleasure when I saw today that we have lots of participants from all over the world. We have a colleague from KSA, from Saudi, from Bahrain, from Sudan, from Ghana, from Greece, from all over the world, and really it's a happy it's enjoyment and happiness to see all these participants. I'd like to share with you the program for today. So for today, we will start with the opening and welcome, and then we will have five sessions by Dr. Bashar, by Dr. Hussein Ozan, by Dr. Nasia, Dr. Amuna, and Dr. Muhammad Abu Zaid. And at the end, we will have a closing remark by Dr. Bashar. Dr. Bashar wasn't aware about this last point. Just now I added. So we will have the closing remark. Celebrating the World Radiography Day, it's a joy in our department, and we used to do it with our students, and our students are organizing many activities, and they are enjoying those activities. Activities range from scientific talk until the awareness among patients and among colleagues. So here, this activity was in 2018, and it was on campus in our college, in the College of Health Science. And those are our students creating some posters, some games just to educate the other people from other departments, while the scientific activities is going on the other hand. Here, the celebration went outside our colleges, and those are the second-year students who are now year 3 students, and they were celebrating the World Radiography Day at Al Kuwait Hospital in Sharjah with the main aim that patient education. And also here, it was in the same years in 2019. Those are the, I guess now they are the 4th-year student. They were 3rd-year student. And their participation, it was in the celebration of World Radiography Day in Dubai Hospital, and the same at Dubai Hospital was sport imaging. So it's usually that our department celebrate the World Radiography Day, and even this year with this distance learning or online learning, we continue our celebration, And this is how the World Radiography Day in 2020 look like. Now I would like to welcome Dr. Bashar. I would like to welcome Dr. Bashar for the first session, Impact of AI in Radiography Education. Dr. Bashar, he is the chair of the Department of Medical Diagnostic Imaging at University of Sharjah, and we are really happy to have him as a chair. He has lots of fingerprints on the department. He holds a PhD in magnetic resonance imaging from Nottingham University in UK, and he has a teaching experience of over 20 years, and he is a member in the International Society of Magnetic Resonance Imaging in Medicine since 1992. His CV has lots of work, but just I took some of them for a snapshot just to introduce Dr. Bashar to his session, Impact of AI in Radiography Education. Welcome, Dr. Bashar. اتفضل.
Assalamu alaikum.
وعليكم السلام والرحمة.
Let me just share this. Thank you very much, Dr. Wiam. I'm sure I don't deserve this very nice introduction, but Assalamu alaikum and good afternoon for all the participants. Again, I would repeat what Dr. Wiam has mentioned. It's really happy and joyous feeling to see all participants from so many countries, hospitals, and educational institutes. So I would like to start by thanking Dr. Wiam again for moderating. I also want to thank Dr. Amin Al-Marzouqi, the Dean of the College of Health Sciences, for supporting the department. I want to thank Dr. Mohammed Abu Zaid, who has taken the lead in really setting up this webinar session. I'm lucky because I have a fantastic group of people working in the department, all of them faculty, lecturers, and tutors. And without the collective effort of everybody, it would have been very difficult to really achieve anything in the department. So I'll try to be about 20 minutes just to introduce a very, very brief introduction about artificial intelligence in radiology, some applications. I have something saying move this window. I don't know if Dr. Wiam can help me. There is a window in the middle. Is the picture clear, by the way? Is the slide?
It's clear, Doctor.
Okay. So I will talk briefly about the artificial intelligence in radiology, some applications, challenges, and risks. And then I will move into radiography and hoping to end with radiography in education, really. So what can we do or have to do to our students? So at the moment in radiology, there are some challenges for radiologists and for radiographers, mainly the huge volume of images that they have to tackle every day. So for radiologists, they have to really be looking at maybe 3 or 4 images every at an image every 3 or 4 seconds throughout a whole day, which may go for about 8 hours. There is also a huge development, very, very fast development in so many areas due to the advances in technology. So many new sequences and series that can be used, so many processing softwares that coming into, there's a huge noise coming in.
Excuse me. I mute someone, it's okay.
Okay. So as I said, there are so many rapid technical advances that really change the area of radiology and radiographers. And what we want to see maybe is just to look at the applications of information technology, IT, for the healthcare. You see, these technology or advances in technology, they really drive our work, but also our work drives them. So when we have a new set of maybe protocols or processing softwares, they allow us to do more things in terms of the clinical scan. And when we do more clinical scans, more advanced, more complex ones, then we need new software to analyze them and sequences to look at them. So IT is really a driver and driven by clinical imaging. So what are the, if you like, the flavors of artificial intelligence in radiology? Well, basically, so far they have been used to assist radiologists or sometimes even replace radiologists in looking at the images and making some decision about these images. But also they can extend the ability of the radiologist. They give the radiologist more tools, more quantitative tools to really use. Radiologists can use their eyes to look at images, but sometimes it's difficult to do some number crunching, and softwares do that. So simple definition of artificial intelligence is basically the ability of the computer program and the software or the machine to really think and learn. So it uses some data, some images basically, or some numbers that were extracted from images to learn some patterns. Of course, we can argue after that maybe they can also make decisions. But there are different types of artificial intelligence. I mean, 3 of them are there, but I'll just give a brief, if you like, introduction to machine learning. But basically, they are algorithms, they are programs that learn from data. And then basically they try to apply what they learned from those, if you like, sets of huge amounts or numbers of images. And most of the time, there will be these algorithms, these programs, they will be looking to find a pattern, a certain pattern in these images, upon which they can make a decision. Now, of course, in machine learning, there are so many types, but basically, we can also talk about, is there any human intervention or not? In other words, are these algorithms supervised or non-supervised? So do they need some input from the humans to learn, or do they learn, if you like, independently, yani automatically? The most common application is basically to correctly identify chest x-rays, yeah? So are these malignant nodules or not? And of course, nowadays with the pandemic, this will take more, if you like, importance. Some other applications which really require fast computers and efficient algorithms, in addition to finding patterns, is to identify some specific anatomical markers, what we call segmentation. So I look at a slice of the brain and I want to find out where the CSF is, where the gray matter, where the white matter is, and so on. So this is basically segmentation. More applications, of course, computers can spot details that the human eye cannot see. So if there isn't much contrast in the image, then the human eye may actually miss those details, but computer looks at the numbers, and you can set up the threshold for those numbers, and the computer can really spot them. Of course, nowadays we have more and more of image fusion. So we want to combine images from different modalities. Some of them are better in terms of anatomy, others are better in physiology or function. But if you want to combine both of them, then it's good to use the computers to do fusion or merging. So those are some applications. But the main benefit of artificial intelligence in radiology is basically you can improve the throughput. Basically, you can do more data analysis, more scan analysis without really sacrificing the quality. So nowadays, we have every day more and more of these huge image data sets from both MRI and CT, and it would be much better if we can automate them. So one way that artificial intelligence can be very useful is to really shift these simple tasks away from the radiologist and leave more time to the radiologist to tackle the complex cases, but also to do more interaction with actually patients, so they can really focus on the critical cases, okay? Computers, as I said, they will do a better job than humans in really co-registration or fusion of images from different modalities. Other benefits is basically, as I said, they can detect details or features that the human eye can miss, again, because they rely on calculating numbers, and no matter what differences in these numbers, they can always be picked up by the computers. Segmentations, I mentioned that, but at the end, they will give a second opinion to the radiologist, and sometimes they give the first opinion, actually. They give the whole opinion. I give you some examples from my work. Don't be surprised, this is actually correct, 1998. I had a PhD student, Adrian Knowles. Adrian was actually a radiographer, not a physicist or a biomedical engineer. But he had an MSc in radiography, and he was very good in IT. So he came up with this idea to look basically at the classification of breast cancers, basically, using neural networks. So these are basically, if you like, multi-layers of small processors, just like how the brain is organized. So many small neurons organized in huge numbers and in huge layers, and they do probably a better job than having a big machine. And we basically wanted to ask these neural networks to do learning by themselves, so that they do ROI, region of interest selection, almost semi-automatically. And then they would extract so many parameters from basically those were gadolinium enhanced images in MRI. At that time, we were actually limited by the computer power, but this is a more modern example, not our works, but basically it's similar idea. So they're trying to use artificial intelligence or neural networks to basically make a decision on spotting where the lesion of interest is, and then basically extracting it. So you can have a human ROI selection, or you can have an automated ROI selection, and then you can always do this repeatedly. So very often, radiologists actually do similar tasks twice to just check the reliability and accuracy of their decisions. If you have a computer, this could really save the radiologist a lot of time. Some other examples, I just picked up this from the literature. So I think some of you are aware of this Nvidia. So they are producers of many of these image software, what do you call them? The interface networks in our computers. So they have a huge amount of memory, huge amount of processing powers. And they combined with basically the biomedical engineering department in King's College in London. And they basically, again, trying to apply this artificial intelligence on imaging sets in the hospital. And they offer a huge amount of really processing power and memory. A small university or even a large university sometimes cannot really afford this much. Now, there are so many challenges with artificial intelligence. For example, variability of images. So these images, they change. We always talk about the biological variability. So from one patient to another, we have a huge variability, which makes it more difficult for the computer programs to pick up patterns, okay? And even when they pick up patterns, when we are doing this learning process, we need to carefully check and approve these decisions. So at some stage, we need to verify these decisions made by the computers. So, the ground truth, what is absolutely correct in these decisions have to ultimately come probably from the radiologist. So we still need the radiologist to verify these and to really confirm the decisions of the computers. Other challenges that are probably not very well realized. So we need some regulation to organize this artificial intelligence intrusion into imaging. We need qualified personnel and maybe bodies, organizations that will set up the pathway for these, if you like, routines, how we can introduce artificial intelligence into our environment. You see, at the moment, the introduction of artificial intelligence into imaging is more or less driven by manufacturing companies for clinical scanners who want to produce better and better decisions. And there isn't really a lot of regulation that govern and organize this process. There are many ethical questions that need to be answered. For example, if a machine can select higher radiation dose in order to produce a better image, would the machine allow this? I mean, a human decision would say, no, I'm not going to really sacrifice my patient safety. I'm probably going to sacrifice some of my image quality. But these are some of the issues that really need a lot of discussion at the moment. There isn't really a lot of consensus about these. Now, let's turn into radiographers. So I've now talked about the, if you like, the introduction of artificial intelligence into radiology, i.e. into hospitals, basically into radiology department in hospitals, and their effect and their impact into both maybe the radiologists and the radiographers, but in the hospital. What I want to focus now is the effect on radiographers in the educational stage, in the university. And basically these radiographers, their role is to assess and basically develop optimum techniques, produce images, but then also to evaluate these images. And at the moment, these radiographers have to acquire what I consider a large range of skills and knowledge base. So they start from patient care and communication skills, all the way to science, if you like, fundamentals from physics, chemistry, radiation, instrumentation, and also biology and anatomy. And then they move on into the imaging, if you like, courses, imaging details, or radiology, if you like, and they end up with pathology experience. And while they are doing this, they go through a lot of skills build-up in terms of doing labs at the university, in terms of going into hospitals and practicing basically clinical practice. So they try to implement these skills and knowledge into their practice. So at our university, University of Sharjah, basically the program has been very successful for maybe 20 years or so. It's a 4-year program, which is basically covered, hopefully, in about 8 to 10 semesters. In terms of credit hours, it's 137. And as I said, it contains a lot of lab theory and clinical practice. At the end, while they are doing their clinical practice, at the final year, they also do a research project. Now, from the previous slide, you can see there is a huge range of topics, from basic sciences to healthcare to finally imaging. So it's a really large scale of skills and education. This is just an example of, if you like, the second year program. You can see so many varieties of courses, but I want to basically draw the attention that even in the second year, so this is second out of 4 years, the students start doing their clinical practice in the hospitals. This is in the second semester, so that they really can strengthen what they learn in the hospital. Now, what are the current developments or indeed challenges that our graduates can basically face up to or take opportunity of? So at the moment, if you ask if you ask a batch of students, they will probably tell you, we want to go and be sonographers, especially if they are female. Now, of course, sonographers have huge amounts of, if you like, application in the job market, request in the job market, and they probably get a better paid sometimes. And that's why a lot of the students think about sonography. Now, radiotherapy in our department is not on at the moment, but this is maybe one of the long-term objectives of the department, to also include, in addition to the diagnostic ability, some therapeutic abilities as well. Other developments or challenges, is both of them actually. Now, most of the advances are happening now in terms of really the ability to look deeper and deeper into the biological systems, and the ability to create some new technology that can interface with these biological systems. So we are more and more able to look into the function of the brain using the various techniques. And we are more and more able to maybe get some signals from the brain, but also to send some signals into the brain. Other developments, like we're trying to set up some postgraduate programs that can tackle some of these issues. And we have seen some of the problems. For example, in the current pandemic, we had to face many challenges in terms of the clinical practice of the students, but we also took some opportunities. So many of the researchers in the university are actually trying to work in discovering new testing systems for COVID, and maybe some kind of, early detection for the COVID, but a reliable detection system for the COVID. So you can see there are so many developments and challenges that are happening around the imaging science. And what we want to do is we want to convert a lot of these challenges into opportunities for our students. And other developments that are very important at the moment, and maybe some of my colleagues will talk about it, some of these were actually covered previously in previous seminars organized by the department as well. So one of them is the changing role of the radiographer. So in addition to taking images, in addition to interacting with the patient, in addition to checking the quality of the images, organizing all these events in the radiology department, maybe they can start a report on some of these images. So some of these advances are happening in other countries, like Australia and the UK, but they are really still in its maybe infancy. I think Saudi Arabia is also starting some of this practice about reporting. So the radiographer will have to do some more courses, have to acquire more skills before being allowed to do reporting. What we would like to do also, and see from our radiographers, whether in universities or in hospitals, is to be able to do more research. There are so many opportunities, but they have to be really qualified to do research projects, even small research projects. But those require more skills as well. And the third development in radiography is what I talked about in terms of artificial intelligence. But again, all of these developments, they really require, in addition to education, they require some regulation. They require some, if you like, supervising body organization that can make sure that a lot of these developments are happening in the correct procedure. But certainly, we are trying to, do our best to introduce some of these. So my colleagues, Dr. Mohammed, Dr. Wiam, and others have really produced some wonderful research very recently about the, if you like, the willingness of radiologists and radiographers to integrate artificial intelligence into radiology practice. Now, this is a very important paper because it's only few of them, only 15 in the literature, and one of them comes from my colleagues from our department. It's hugely important, and I'm sure Dr. Mohammed will probably refer to it again in his talk. But one of the important results of that paper that was asked to radiographers and radiologists is the question that you see at the top. How well do you understand what is meant by artificial intelligence? And you see the blue area here, almost 40% said, well, we don't know what it is. And some others said, we only have basic introduction, basic knowledge about it, and so on. Of course, in their paper, they also talked about the lack of structured education in artificial intelligence. And this is something we will probably try to introduce into future modifications of our curriculum. So what do we need for our radiographers to be, if you like, included in their curriculum? We need some, basically, what we call data science or algorithms, statistics or mathematics, and so on. So at the moment, most of the radiologists and radiographers think about artificial intelligence is like a black box. They basically press some buttons or read some reports coming out of the machine without really getting the full picture of what's happening inside the machine. So this is what we will be working on in the very, very near future in terms of our curriculum to our radiographers. We will be shifting some of the, if you like, emphasis from general radiography into more advanced modalities such as MRI and CT and so on. We will be trying to introduce some IT modules, basically some programming into the curriculum. Very simple ideas. And we have already actually tried this last spring in the research projects. Some students started doing this, and I think they have enjoyed it. So in conclusion, there's a huge, really huge area of opportunities for collaboration between different disciplines within the university itself, but also obviously with hospitals in the area of artificial intelligence. And what they offer, they basically offer saving of huge amount of times while really maintaining the quality of the service. But in order to do that, we really need to equip our students and radiographers with the appropriate tools and skills. And it's really, if I want to pick just one skill, then it will be really in the area of programming mathematics, or mathematics and programming. Now I'll leave you with this last slide. You know, Steve Jobs, all our students know this guy, the late Steve Jobs. And basically, if you look at this statement, the underlined statements, he talks about the intersection or interaction between biology and technology. Well, what he means is the effect of the brain on everything we do, and also our understanding of the brain. This is what he means when he talks about the biology. And it's a huge area, undiscovered area. But most of the technical advances in terms of our healthcare are really happening because of the technical applications into the, well, not micro, nano biological systems. Thank you very much. And I think I'm just about used 27 minutes. So thank you very much indeed. Shukran.
Thank you very much, Dr. Bashar. Is there any question? Is there anyone have a question, please? We have 3 minutes for discussion.
I posted a few questions. Sorry, my name is Shubair. I'm from UK. I posted a few questions. I will have to go back to the chat session into that one to look for it and repeat. Yeah, I mean, when you're talking about the advancement and the advanced practice, I mean, in UK, there is a system where they're having a radiographer-led discharge system, which takes the burden of the busy A&E system, especially in the times of the COVID. So radiographers are actually trained like the advanced nursing practitioners in the same way. So they look at the X-ray and they see if there is a fracture, they need to go to the fracture clinic, otherwise they can go home. And that takes some burden, you know, in terms of the district general hospitals, not of the major trauma center, but the district general hospitals. Also the presenter at the moment, sorry, Dr. Bashar actually talked about the application at the King's College Hospital. So I'm lucky to be part of that one for some time. I worked in neuro at King's College Hospital, where we applied the AI in particular with the MIDI studies. So to develop the algorithms, we had to recruit about 30,000 patients who will agree to allow their scans to be actually go as part of it, which will not compromise their information, but it will be anonymous. And also, along with it, the radiologists who are working on it. So those are, yeah, some of those things which could be introduced in Sharjah, and that would be brilliant, because we always learn from the practice. So in particular, the glioblastoma, that study is the GBM study is still ongoing. So if there is anything I could do with regards to that one, you let me know.
Thank you. Thank you very much. Yes, yes, excellent. Yes, thank you very much.
Any more questions? I see here Muhammad Hijazi, he has a comment about shifting hours from general radiography to advanced modalities is a great idea, where I, as a previous graduate, see its importance. Welcome, Muhammad Hijazi. It's a pleasure to hear feedback from our students. Currently, we are working on updating the study plan, and Dr. Bashar can talk a lot about that. Please, Dr. Bashar.
Well, yes, I mean, it's good to see really former students. I haven't really met them because I've only been here for 3 years, but yes, I think Dr. Muhammad also talked about this before. I think we need to do that. We discussed this even with the external evaluators or visitors. I think last year we had some feedback also from them. So hopefully at the end of this spring semester, hopefully we will have a new, slightly modified, but we will be trying to do this one suggestion. We will be trying to do introduce some mathematics or programming, very simple, And also we have to look at maybe IT applications in a separate module to go maybe replacing some other packs or something like this. Okay.
Thank you so much, Dr. Bashar. I see lots of some comments here from Gotham, from Ghaida. It's a pleasure to see colleagues, students, and even former students or a graduate. It's really a joy to see or to hear all of you. We are not able to see each other, but at least we have a way of communication, alhamdulillah. Thank you, Dr. Bashar, for this informative session.